In this episode of Careers That Matter, I'm joined by Dr. Linda Carlson, the co-winner of the 2023 Dr. Rogers Prize for Excellence in Complementary and Alternative Medicine. Dr. Carlson is a professor of oncology at the Cummings School of Medicine and an adjunct professor of psychology at the University of Calgary. Dr. Carlson, thanks for joining me to talk about your career. What exactly is your job?
Well, it's funny too, because I was just saying my kids have a hard time telling their friends what I do because I'm a university professor, but I don't teach like big lectures of classes. I'm a researcher, but I'm not like wearing a lab coat dealing with test tubes. And I'm a psychologist, but I'm not sitting in a chair giving advice most of the time. So what am I really? My job title is one of them, professor in oncology at the University of Calgary in the Cummings School of Medicine. Professionally, I'm trained as a clinical health psychologist, so a PhD in clinical psychology within the health domain. And so health psychology or behavioral medicine is working with people who have medical conditions and looking at lifestyle factors, looking at how emotions and thoughts play a role in disease progression or coping with disease.
So what does a day at work look like for you then? Dealing with your puppy, obviously.
Yeah, dealing with my puppy.
Yeah.
So as a professor, mostly I'm a researcher. So about 80% of my time is spent on research. And the type of research I do is looking at mostly clinical trials of interventions to help people with cancer, to help them cope using different complementary therapies or mind-body therapies mostly. So these would include mindfulness-based interventions, things like yoga, acupuncture. We've even done animal-assisted therapy, Tai Chi, Qigong. So lots of these different types of interventions to see how they might help people, who they might help, in what circumstances, for what kinds of problems. And so I conduct clinical trials in that area.
And so you're actually like interacting with a lot of people then?
Well, so in my role also is as a clinician. So I actually deliver some of the interventions, but mostly just the mindfulness-based interventions. Yeah, and so when we're doing the clinical research, we're recruiting up to 600 people in the last study we did to participate in a clinical trial where they could do mindfulness-based cancer recovery or they could do Tai Chi and Qigong. And then we followed them up through the course of doing that 6 months later, and we would take blood samples and we would take saliva samples and have them fill out a whole bunch of questionnaires to really get at what is happening when they do these interventions.
And then you have to make sense of all that information that you've gathered.
Yep.
So what's that process like?
Well, I love that. So, early in my career, I would do all that myself. Like I would do get the database, do the data analysis, write the results. Now I have a biostatistician who does that kind of work. But yeah, we collect the data, we crunch the data, we figure out what the results are. And then what I love doing is actually writing them up for publication, in peer-reviewed journals, and then going around to different conferences and presenting them and, kind of trying to get the results out into the larger community of patient advocacy groups, and seeing the results applied into then eventually clinical services if we find an intervention is really promising for someone.
Well, you've touched on a couple of other aspects of your job then, because you're writing papers.
And grants, to fund this work, yeah.
You write books.
Yeah. And that's part of just getting the word out. So I've also written a textbook, which is like training for healthcare providers on mindfulness. It's called The Art and Science of Mindfulness. So that's a training textbook for, psychologists and other healthcare providers in training. And then we've also written a book for patients. So it's a home study program of the mindfulness-based cancer recovery.
And then you're presenting, does that mean that you're presenting like on Zoom, or are you like moving around the world?
Both. Yeah, I get invited all over the place. Like I just came from the Moffitt Cancer Center in Florida where I was doing grand rounds for all of their staff. I'm going to Portugal in another month to present to the Portuguese Psycho-Oncology League a workshop on mindfulness-based cancer recovery to help them understand how to deliver the intervention to their patients. So I do a lot of that. Another thing I do a lot of is, I guess I'd call it leadership in different professional societies. So there's societies, for example, there's one called Society for Integrative Oncology, which is an international society with about 600 members who all practice integrative oncology. which is trying to evaluate and deliver different integrative therapies that are evidence-based for people with cancer. So moving the mission forward by being part of leadership there in different projects that we're doing.
Yours is not a 9-to-5 job.
Well, no, definitely. I mean, there's periods where there's a lot of work that might happen on the weekend. If there's a grant due, like right now I'm writing a grant coming up to a deadline, and this is how we fund the research, is by getting, funding from national, provincial, or private foundations to help fund the different projects. So I'm often doing that, and that's definitely not 9 to 5. And a lot of the traveling to go to conferences and present is, on the weekends and that kind of thing. But it's also very flexible, which is wonderful for someone who's got a growing family and, lots of self-care that I do. So I spend lots of time in the mountains. So I'm pretty good, I think, with work-life balance in that respect. The other reason I think that's very important is in modeling how to be a professional who has that kind of self-care and work-life balance for my trainees, because I do a lot of training. So I'm not teaching, huge classes of hundreds of undergrads. I'm teaching individual students who are getting master's, PhD, postdoctoral training on how to do this kind of research specifically. And so they all have a project that they're working on where they take the lead mostly, and I help them understand how to do all this. And, by doing the research is how they get their training.
So you went to university. What disciplines did you study that led you to where you are now?
When I started undergrad, I had no idea what I was going to do. I had an interest in the sciences. So I think in my first year of undergrad, I took chemistry and, physics. And I also took a few options. And it was the options that really engaged me. And I took psychology and sociology and, I took astronomy, a number of different things. And I fell in love with psychology. I really did. And so focused on that as a major for my undergrad. And then really, there's not much to do with a bachelor's of science in psychology. And so I thought, well, I'll go on to grad school and I'll get a clinical psychology degree, because then you have a lot of flexibility. You can be a clinician, have a private practice or work in a hospital, but you can also be an academic and have a professor job and be a researcher. And so that was my interest going into my PhD. But even then, I had no idea what specific area I was going to focus in. But I had an interest in mind-body therapy, so I started studying something called psychoneuroendocrinology. And that's looking at how thoughts and feelings affect our hormonal systems. So I was looking at estrogen and cognition specifically, actually, for my PhD. Looking at how estrogen, testosterone, cortisol, other steroid hormones were affected to learning and memory in healthy elderly women and in people with Alzheimer's. So that was my PhD.
But that wasn't actually the thing that led you to where you are.
No,
now.
not at all. not at all. And it's funny when people tell the story, it seems like such a linear path, but nobody's career is like that. And so I came back to Calgary after finishing my PhD and was doing a clinical year, which you have to do. And that's when I had a rotation in psychosocial oncology. And that's where I met people who had an interest in mindfulness. And I also was introduced to an environment that was very supportive of clinical research, of integrating research into clinical care and education, and lots of opportunities in that space. And so I just sort of kept following the opportunities and following my interests. So after my PhD, I applied for a postdoctoral fellowship to keep studying mindfulness. We had just started, and that funding came. And then you don't know where the next thing's going to be. But after the postdoc, it's like, okay, I applied for the next level of funding through CIHR, the Canadian Institutes of Health Research, and got 5 years of new investigator funding. And then an academic position opened up, largely because my division head lobbied for such a thing. And so then I would apply, and I got the academic job. And then our department fundraised for a research chair. And so I applied for that and got the research chair, and so each step has followed the next. And I've had so many opportunities at the University of Calgary and been able to follow my passion. And the thing about being an academic is it is very independent. It's very self-directed. And if I got bored with studying one thing, I would just study something else.
So for a young person who might be looking at you going, Linda, I want to be like you. What would you say is the personality characteristic that you possess that allowed you to explore and discover an entirely new way of being in a new career? I mean, you're defining something that didn't exist before.
It's a good question. I'm optimistic. I always think things are going to work out. I follow my interests. I have confidence that, the next path will appear when it needs to, right? Some people want to have it all laid out, and that's just not the way the world is, especially when you're doing something new. You're charting your own path. So I have a, very strong innate sense of curiosity. I just always want to see what's around the next corner. I've always been that way, have to explore the whole campground. So this curiosity drives me forward, and I always feel like it's going to work out, because that's just my personality, is that everything's going to work out. I don't know how, but it will. And, I always sort of open to opportunities, right? Like I have them in the back of my mind, I'd like to do a study on this or that, and then someone will cross my path who has the skills or the funding or the grant. And I'd be like, hey, this is something we've been thinking about, right? And so in that way, it's serendipitous to a certain extent, but it's always going in a certain direction too. I always have kind of a high level plan, sort of, like I kind of want to go this way, and then I'll see where the opportunities arise. And also, I think being very collaborative. Like I have hundreds of colleagues that I've done studies with and published and written books and things like that.
Well, thank you for giving us a glimpse into your day, your life, your career path. And we will watch as the world continues to unfold for you now.
Well, thank you.